Hello everybody. Let's start with the second part of the bacterial infection. Today we are going to see about tetanus. This is Dr. Sreeja, professor from the Department of Oral Pathology, Chettinad Dental College and Research Institute. Tetanus is an acute infection of the nervous system which is characterized by intense activity of the motor neuron resulting in severe muscle spasm. This is caused by the exotoxin released by the anaerobic gram-positive bacilli, Clostridium tetani. The toxins are tetanospasmin and tetanolysin. The predisposing factors are usually in places like Asia, still home pregnancy is being practiced, and during the procedure, the lay attendant can use unsterile instrument to cut the umbilical cord of the child, which can cause tetanus in newborn. Children who have ear infection, they start handling the ear with some kind of unsterile instruments, or they can use hairpins, or they can use safety pins, which has rust in them, or it can have kind of tetanus in them. So this can cause infection of the ear, tetanus of the ear. And some women still practice self-abortions. And during the procedure, if they use unsterile handling of the genital tract, this can cause tetanus. And also after acute trauma, tetanus can be present. Pre-existing abscess or pre-existing trauma, this can serve as a place for the growth of the anaerobic bacteria, which can cause tetanus. The clinical features are the incubation period is about 3 days to 4 weeks, and it can be short as 1 day or long as a month due to the dormant spores in the wound. Clinical features. The clinical features can be remembered if you remember the mnemonics carotid. Okay, in local tetanus manifests as a spasm of the muscle very close to the wound. C for cephalic tetanus means the tetanus that occurs on the face. So this usually occurs after head injury. So trismus and facial palsy are the most common feature of cephalic tetanus. A for asphyxia. If the spasm extends to the larynx, there will be difficulty in breathing. This is called as asphyxia. There is tetanus of the face, which causes rigid facial muscles. The feature is called as rhizus sardonicus. Contraction of the muscles of the back produces an arch-shaped defect, which is called as ophistotonus. The patient can have trismus or lockjaw due to the spasm of the masseter muscle. D for dysphagia, which is the stiffness of the or pain in the neck. So C-A-R-O-T-I-D. C for cephalic tetanus, A for asphyxia, R for rhizus sardonicus, O for ophistotonus, T for trismus, I for anaerobic infection, and T for dysphagia. How do we diagnose tetanus? There is a test called spatula test. So in normal person, when we try to take a wooden spatula and place it in the posteriormost part of the pharynx, we tend to have a gag reflex. But if a patient is positive for tetanus, they will not produce gag reflex. They will start biting down on the spatula. This is called a positive test for tetanus. Prevention, a combined vaccine is given, DPT vaccine, diphtheria, pertussis, and tetanus vaccine, or you can go for post-exposure prophylaxis, tetanus toxoid. So every 6, if it's not taken for a period of 6 months, that TT, then we have to definitely go for administering TT post-exposure. So this is about tetanus. Hope you all understood. Thank you.